So yes, hello everyone. So am I audible? Is the screen clear so that we can start the session? This is the Brachial Plexus-I targeted for the MBBS examination. So let me just check. Yeah, so let me just check. So yes, I'm audible and the skin is also clear. So we can start the session now. So that is great. So we can start the session. So my dear aspirants, let's start with the session now. Before that, I would like to tell everyone about the platform of Unacademy and about myself. Okay, it's about the platform of Unacademy and about myself. So myself, Dr.Monalisa, I have done my MD Anatomy from Armed Force Medical College, Pune, and I am here to discuss the brachial plex, which is a very important topic of the upper lip. Now let's talk about the benefits of joining the special free platform of Unacademy. When you are being the part of the special free platform of Unacademy, you can have present in the interactive sessions of the Unacademy, special class features free, and you can participate in the polls conducted during the session, which will be highly beneficial for you. You can raise your hands and get your doubts clear right itself when the session is going on. Never ever miss a session. So this is another important feature of the Unacademy platform. If you start seeing the session and start following the educator on the Unacademy app, thereafter you get the notification regarding all the session taken by that educator. So once the session is finished, you can also download the PDF notes. Anywhere, anytime, read from the top educators of Unacademy platform. The students who are watching the session for the first time, they can use the code NAT10 and get enroll for the free sessions of Unacademy platform or for any of the tests and quizzes which is on the free platform of Unacademy. I would also like to inform you about the All India mock test which is going to happen on 19th Feb 9 am. This is the code which can be used by you. So you can enroll in this free test by using the code NAT10. This will be highly beneficial for you. Now let's talk about the plus subscription. When I'm talking about the plus subscription, it means all the 19 subjects can be studied in a very systematic way. You can study from India's top educators. You can compete in live tests and quizzes. You can study on the device of your choice. You can assess more than 25,000 MCQs, and soon you will be provided with the printed notes of Unacademy. So these are the benefits of joining the plus subscription. So just go for it. And I would also like to tell about Iconic subscription, where you get the benefits of two platforms. One is the Unacademy Plus and other is the Prep Ladder. That means you can have the benefit of access to the two best platforms for targeting a better rank in the competitive exam. So you can be the part of clinical, integrated essentials of the prep ladder, video lectures taken from the dream team. QBank 3 can be assessed, rapid revision, snapshots and treasure dream notes. All these can be assessed by you. This is highly beneficial. And you can apply my code and add 10 to get an extra discount of 10%. Now, I would like to congratulate the toppers of FMG December session. So, I wish them best of luck so that they can target their next or NEET PG exam with their best rank in the first go. I would also want to show you this pricing detail of the Plus and Iconic, where you can have the comparison of the pricing detail of both Plus and Iconic. This will help you to decide which subscription you have to take, and it will also be decided on which year you are residing. So the students who want a discount of 10% extra, they can use my code NAT10 and get an extra discount of 10%. Now, let's talk about the highly effective QBank of the Unacademy, where more than 25,000 MCQs, high yield clinical MCQs based on latest pattern of exam, which includes a detailed explanation for each and every MCQs can be targeted. Use the code NAT10 and get an extra discount of 10%. So let's start with the topic. Today's topic is a brachial plex topic. Actually, this topic is very important not only for targeting the students, the aspirants, but it is also very important if you are going for any competitive exam. If you are targeting NEET PG, INICT or FMG exam, it's highly beneficial. Other than that, it is the important topic to be understand for your university exam in the first and second prof also. So brachial plexus. So let's talk about brachial plexus in detail. So when I am talking about brachial plexus, it's a plex. What do you mean by the word plex? Plex means bunch. Okay. So it's a nerve bunch which is formed by, it is a nerve bunch which is formed by the lower cervical and that of the uppermost thoracic spinal nerves. Together they are forming a plexus of nerves which is called as brachial plexus. So and it's actually if you will see at times it is also taking contribution from T2 spinal nerves or C4 spinal nerves. So I will show you a diagram explaining that. So first thing is that let me first define what is brachial plexus. So brachial plex, which is the topic to be covered today. So when we are talking about this topic, it is the plexus of nerve. It is plexus of nerves. It is a plex of nerve. You can say plex, that is the group or the bunch of the nerves found so it is formed by the anterior rami of, anterior, that is also called as ventral rami of C5, C6, C7, C8 and T1. Okay, so this is the most common formation of brachial plexus. Okay, it is formed by the anterior rami of C5, C6, C7 and C8. This is the most common. At times what happens, it can be formed by taking contribution from C4 or T2. So let me also tell you about that. Okay, then so let me talk about the brachial plexus prefixed. So actually there is two. So normally the formation is from C5, C6, C7, C8 and T1, but at times it can be formed by taking contribution from C4 and T2. That time the brachial plexus is called as prefixed or postfixed brachial plexus. So write down prefixed brachial plexus. So when I use the term prefixed, what does that mean? The word prefixed is used, means that the brachial plexus is formed by taking contribution from fourth cervical vertebra. Okay, so that means when the brachial plexus is formed by taking contribution from C4, it is called as prefixed. It is called as postfixed brachial plexus when it is formed by taking the contribution from T2. So today we will discuss all the details of how the formation is done. So I have targeted 2 sessions for brachial plexus. Today I will tell you about its formation, its roots, its trunks, its division, its cords and the branches. And tomorrow we will talk about the lesions of brachial plexus, and day after tomorrow the MCQs related to the topic. Okay, so let's talk about the components. So thereafter I would like to tell you about the components of brachial plexus. Okay, so if we talk about components of brachial plexus, it is having roots, it is having trunk, it is having divisions, it is having cords. So it is important to know the formation of each component and where it is lying. Okay, so when we are talking about roots and the trunks, okay, when we are talking about roots and the trunk, it is located in the neck region. The division is lying exactly behind the clavicle. The division is located exactly behind the clavicle, and the cords of brachial plexus, which is the posterior cord, medial and lateral cord, cords of brachial plexus is located in the axilla region. Already we have covered up the topic of axilla boundaries, and there in the topic of the content of brachial plexus, in the topic of the content of axilla, we have seen that brachial plexus was residing inside the axillary region. Now, so this is a diagram which is showing you the brachial plexus. So here you can see this is the brachial plexus, and actually the trunk of brachial plexus, if you will see, it is emerging out between the scalenus group of muscle. Okay, so let's me give you the details of roots, trunk, and then I will also draw a diagram so that you can better understand this topic. Okay, so firstly let's talk about the roots. Roots of brachial plexus. So when we are talking about the roots of brachial plexus is formed by contribution from, it is formed by the primary anterior rami of. Any doubt you can ask me, I am seeing the messages also. If you have got any doubt, you can ask me. It is formed by anterior primary rami of C5, C6, C7, C8 and T1. And the roots of brachial plexus are located in the neck. It is located in the neck deep to scalenus group of muscle. It is located in the neck lying deep to scalenus muscle. To be more specific, deep to scalenus anterior muscle. Now let's talk about the trunk. So actually what happens here, C5, C6 will join to form the upper trunk, C7 will form the middle trunk and C8 and T1 will form the lower trunk. So when we are talking about the trunk, we have got three trunks. Three trunks are there in case of brachial plexus, and actually C5 plus C6 will join to form the upper trunk, C7 will form the middle trunk and C8 and T1 will join to form the lower trunk. Okay. So when we are studying the posterior triangle and we are seeing the emergence of the trunk, so we will see that the trunks are emerging is located in the subclavian triangle. So actually these trunks are emerging. If you will see the diagram here, what you can see, the brachial plexus are emerging. To be more specific, this is UT, this is MT and this is LT. What is that? That is middle trunk, lower trunk and that of the upper trunk. So the trunks of brachial plexus are emerging between the scalenus muscle, scalenus medius and that of scalenus anterior muscle. So trunks of brachial plexus are emerging. Trunks are emerging between scalenus anterior and medius muscle. Okay. Scalenus anterior and medius muscle. Now let's talk about the division. Actually each of these trunk, when we are talking about the brachial plexus, each of this trunk will divide into division, that is anterior. It will divide into anterior division and that of posterior division. And exactly location of division is behind the clavicle. Behind the clavicle. Behind the clavicle. So here I want to more elaborate it and write how the formation of cords occur, but I just want to draw a diagram for it. So for this I would like to draw a diagram for it. So let's move on with the drawing with the diagram, because that will help you to understand how the different components of brachial plexus is formed. So please draw a diagram along with me. This will help you to understand how the different components of brachial plexus is formed. So I would like to draw a diagram for you. So you can write a heading. You can write an heading, formation of brachial plexus. Okay, formation of brachial plexus is the heading. Now, firstly, let's draw the roots. So I am drawing here the roots. The root is formed by, as we know, roots is formed by C5, C6, C7, C8 and T1. So what are these? C5, C6, C7, C8 and T1. What are these? These are the roots. What are these? These are the roots. Done? So this is the root. So I have made the root, and commonly, as I told you, it is formed by the ventral rami of C5, C6, C7 and C7, C8 and T1. Sometimes it can be prefixed or postfixed. When it is taking contribution from C4, it is prefixed. When it is taking contribution from T2, it is postfixed. Now, we have done with the roots. Now, let's see the formation of trunk. So, see here. Here C5 and C6 will join to form. C5 and C6 will join to form upper trunk. So, what is this? UT, upper trunk. This is trunk. And UT means upper trunk. Now, C7 alone will form MT, that is middle trunk. C8 and T1 will join to form LT, that is lower trunk. Okay. So, this is the trunk of brachial plexus. What is this? This is the trunk of brachial plexus which I have made here. And it is quite clear that C5 and C6 is joining to form the upper trunk. C7 alone is forming the middle trunk. C8 and T1 is join to form the lower trunk. Is it clear, everyone? Please, you can write your messages if you find anything, if you are not able to understand. Now what I told you, each individual trunk, that is the upper trunk, middle trunk and the lower trunk, each individual trunk will subsequently divide into division. So anterior and posterior division. So upper trunk will also divide and form the anterior division, middle trunk, lower trunk. Each of these trunks will have anterior and posterior division, and division is exactly lying behind the clavicle. Okay, so see here. So this is anterior division, anterior division, anterior division. Okay, okay. Now each of it will also have posterior division, posterior division, posterior division, posterior division. Got it? Now, so what I have written here, you can write here divisions. What we are talking about is divisions. Okay? So we are talking about divisions. Divisions. Okay? If you want, I will just... Each of this trunk will divide into anterior and posterior division. Okay. Now, here pink color is used for anterior division. So, this is what? This is A for anterior division. This is also A for anterior division. This is also A for anterior division. Green color is for posterior division and posterior division. Now, anterior division. Now, anterior division of the upper and middle trunk. Anterior division of the upper and middle trunk is joining. Okay. Anterior division of the upper and middle trunk is joining and leads to the formation of lateral cord. It will lead to the formation of lateral cord. So, what is it? It is lateral cord. Got it? This is just to make you understand. This is leading to the formation of lateral cord. Got it? Now, anterior division of, see here, anterior division of lower trunk alone will lead to the formation of medial cord. So, this is what? This is medial cord. This is what? This is medial cord. This will lead to the formation of medial cord. And let me join the green color. So, posterior division of all the three trunks, posterior division of all the three trunks will lead to the formation of, this is just to make you understand. Okay. Posterior division of all the three trunks will lead to the formation of posterior cord. So, this is what? This is posterior cord. So, we have got the formation of posterior cord. If you want, I will write cert above. We have got the formation of medial cord. And we have got the formation of lateral cord. Is it okay? So, anterior division. So, it is quite clear in this diagram that anterior division of upper trunk joins with the anterior division of medial trunk to form lateral cord. Anterior division of lower trunk will continue to form medial cord, and posterior division of all the three trunks, posterior division of all the three trunks will join together to form the posterior cord. So, please let me know, is it clear? Everyone, can you understand the formation? This is just to make you the formation. I am not going to write the branches in this. This is just to make you understand the formation. So, it is just a schematic diagram. Okay, it's just a schematic diagram to make you understand. So, is it clear? Formation of brachial plexus? Okay, so done with this. Now, thereafter, so what I have written, so we have written about the division. So, and before moving to the next, let me just elaborate this diagram. Here, as I told you that you can see the prefixed brachial plexus, if you will see, is formed in this diagram, is taking contribution from C4 along with the normal formation. So, normally it is formed by C5, C6, C7, C8 and T1. Now, here the addition which you are seeing, it is taking contribution from C4. So, this is the prefixed brachial plexus. Now, so we have done with this prefixed. Now, I will show you another diagram showing you the postfixed. So, when it is called as postfixed, this is the diagram showing postfixed. So, see here. So, when you can see T2 is also there. So, when T2 is added on along with the normal formation, that is C5, C6, C7, C8 and T1, this is called as the postfixed brachial plexus. So, this diagram is clearly you the concept of postfixed and prefixed brachial plexus. Is it clear? Postfix and prefix brachial plexus. Now, there is a clinical aspect related to the topic. We will have the clinical explanation of this topic in the subsequent class, don't worry. Now, in this diagram, the 5 major component of brachial plexus, as I told you, when I am talking about the roots are formed by the ventral rami of C5 and T1. Trunks, how many trunks? Middle, lower and upper, located in the subclavian triangle. Division, anterior and posterior, and division is lying behind the clavicle. Cords, we have got lateral, medial and posterior cord, and just now we have seen the how the formation of lateral and medial and posterior cord takes place. Other than that, let's talk about the branches. So, my dear aspirants, now it is quite clear that the roots and the trunks are lying above the clavicle. It's lying above the clavicle. So, any kind of branch, any nerve which is branching from the roots or the trunk, which will be supraclavicular branch. Division and the cords are lying below the clavicle. The location is below the clavicle. That means any branch from the division or cords of brachial plexus will be the infraclavicular branch of the infraclavicular part of brachial plexus. So, please let me know, have you understood? Any doubt you can write me. Are you understanding? Okay. So, done with this. Now, okay. So, now I would describe each one. Now, one more concept before proceeding to the branches of each individual cords. I would like to give you one concept that roots of brachial plexus. Okay. So, what I told you, you should know the concept of anterior rami and posterior rami, because many of the students, when they read upper limb, they have not gone through the spinal cord and the spinal nerves at first year aspirants. So, they are not understanding the word anterior rami. So, I want to differentiate and let you understand the difference between anterior and posterior rami. What do you understand by anterior rami and what do you understand by posterior rami? Okay. So, in this case, let's see. As I told you, the roots of brachial plexus is formed by anterior or ventral rami of spinal nerves. It is formed by anterior or ventral rami of spinal nerves, which we have already talked. Okay. So, it's important that you should know the difference between dorsal rami and anterior rami. Now, first, what you are seeing in this diagram, let me just enlarge this diagram. What you are seeing in this diagram is the transverse section of spinal cord. Now, my dear aspirants, when you see the spinal cord, here the inside part, this is the inner aspect, which is butterfly shaped structure, which you are seeing, which I am outlining with the black color. This is the gray matter. What is this? These are the gray matter. And the surrounding part is the made of white matter. Okay, white matter will contain the nerve fibers and the gray matter will contain the neurons. Okay, nerve cells. So, here actually what happens, we have got ventral and dorsal part. So, when we are talking about posterior, so it is having posterior or anterior root. So, this is A for anterior root and this is P for posterior root. So, anterior root nerve, so anterior roots, all these are what? Motor. They are all motor. When we are talking about the posterior roots, so posterior roots which is arising from dorsolateral sulci and anterior root from anterolateral sulci. These are all sensory, and here you can also see it is containing dorsal root ganglia. So always the sensory root dorsal part will contain, and the ventral is the motor root, which is not containing root ganglia, but dorsal root ganglia is present in the sensory component. Together, the dorsal and the ventral root is together joining and ultimately leading to the formation of spinal nerve. So, what is this concept showing? This is showing that always the spinal nerve will be mixed type. So, for example, when we are studying cranial nerve can be either motor or can be sensory. But whenever we talk about the spinal nerves, it will be of mixed type. It will be both sensory, it will have both sensory and motor component, because the spinal nerves is formed by taking the contribution from both motor root and that of ventral root. After the formation of spinal nerve, it diverges. Okay, it is diverging by forming two rami. It is diverging by forming two ramis, and here the dorsal rami will give innervation. So here when we are talking about the dorsal ramus is responsible for giving innervation to the posterior muscles of posterior or back, but when we are talking about the ventral ramus, it is giving innervation to the anterior aspect of the body, so it is called as ventral is rami is anterior and dorsal rami is posterior. So now when I am telling the word that brachial plexus is formed by ventral rami, that means it is formed by the ventral ramus of the spinal nerve. Which spinal nerve? C5, C6, C7, C8 and T1. So is the concept of rami clear to you? Please let me know. The concept of rami is clear to you. By seeing this diagram, the concept of rami, I think it is clear to you. Each spinal nerves, how many spinal nerves we have got in our body? Anyone? How many total number of spinal nerves? Total number of spinal nerves. Together, total number of spinal nerves or pair of spinal nerves in our body. We have got 31 pair of spinal nerves. How many? 31 pairs of spinal nerves we have got. Okay. Total we have got 31 pairs of spinal nerves. So this is the dorsal ramus of spinal nerve. This is the ventral ramus of spinal nerve which you are seeing. Dorsal ramus and the ventral ramus. Each spinal nerve diverges forming the ventral and that of the dorsal rami. Brachial plexus is formed by the ventral rami of C5, C6, C7, C8 and T1. Got it? Okay. So yes, we have done with this point. And we are also knowing the supraclavicular component of brachial plexus. We are also knowing the infraclavicular. Actually, this point, why I am telling you to revise the supra, we will now read the individual component and the branches from individual component one by one. So here, all the branches which is taking from the roots and trunks is called as supraclavicular component, and all the branches from the cords is called as infraclavicular components. Okay. Now let's talk about the branches of brachial plexus or different components. So for this I will take you again show you this diagram. This is the diagram of brachial plexus, more systematic to make you understand. Okay. So is it okay? Yeah. Okay. So yes, my dear aspirants, here you can see that in between the ribs the ramus of the nerves has been shown. So here clearly you can appreciate here that this is C5, this is C6, this is C7, this is C8, this is T1. Okay. So C5, C6, C7, C8 and T1, this is contributing to form the roots of brachial plexus. So what is it? So what is it dear? It is roots of brachial plexus. This component is roots of brachial plexus. Roots of brachial plexus. Now, in this diagram, we have got following. So, important branches will be shown here. Important branches will be shown here. So, in this diagram, what you can appreciate, two branches has been shown. This is dorsal scapular nerve and this is C5 which is taking contribution from C5, C6 and C7. This nerve which is going long down. This is the long thoracic nerve. So that means here we have got two branches. We have got dorsal scapular nerve which is having the root value C5 and long thoracic nerve which is having the root value C5, C6 and C7. These two are the branches of roots of brachial plexus. These two are branches of roots of brachial plexus. So done. I will again come to this image, don't worry. So we have done with the branches of the roots. So please write down branches of the roots of brachial plexus. Branches of, any doubt you let me know. Branches of roots of brachial plexus. Got it? Now, so the two branches which we have seen in the diagram is, the one is long thoracic nerve. Long thoracic nerve. Now, long thoracic nerve is also called as nerve of Bell. What is its other name? It is also called as nerve of Bell. It is also called as nerve to serratus anterior muscle. Nerve to serratus anterior muscle. So all these, please don't get confused. All these are the name of a single nerve, that is long thoracic nerve. Okay, in short form we can write LTN. The other important point of view is to know its root value. So its root value is C5, C6 and C7. C5, C6 and C7. Now, one more nerve which we have seen in the diagram is dorsal scapular nerve. Dorsal scapular nerve. Dorsal scapular nerve. Dorsal scapular nerve is the other branch of the roots of brachial plexus having the root value C5. Having the root value C5. C5. Having the root value C5. Now this dorsal scapular nerve is giving innervation to, so here we have seen long thoracic nerve is giving innervation to serratus anterior and dorsal scapular nerve is giving innervation to levator scapulae muscle, rhomboidus major and minor. Rhomboidus major muscle and that of rhomboidus minor muscle. Got it? Got it everyone? Now, so we have done with the branches of roots of brachial plexus. Other than that, actually in addition what we can see, in addition the branch from the roots, it's also give a twig to the, it also give innervation, so the branch from the roots. So from the roots it also give innervation to scalenus group of muscles. So these are two important branches. Other than that, it also, if you talk about minor contributor, it also give innervation to scalenus muscle and it also give innervation to longus colli muscle and it also giving a communicating or contribution to phrenic nerve. So please write down the minor branches from the roots. So main branches of the roots of brachial plexus has been done. Other than that, you can write in the roots of brachial plex topic only. The branches from the roots of brachial plexus, it also give minor contribution, it also give innervation to scalenus group of muscle, longus colli muscle, and there is also given contribution from the roots to phrenic nerve. Phrenic nerve. So what is phrenic nerve? Phrenic nerve is the nerve supplying the diaphragm. Phrenic nerve is the nerve giving innervation to diaphragm. So in short, we have done with the branch of brachial plexus and we have seen the important branches from brachial plexus. Just now we have seen important branches are long thoracic nerve giving innervation to serratus anterior muscle. We have seen dorsal scapular nerve which is giving innervation to levator scapulae, rhomboidus major and minor. Other than that, minor branches are given and contributed to scalenus group of muscle, longus colli muscle and to the phrenic nerve, that is innervation to the diaphragm. So done with this. Now I would like to again enlarge this diagram. Okay. Now I would like to enlarge this diagram and I would like to explain about the upper trunk. Explain about the trunks of brachial plexus. So in this diagram now you can see here this is C5, this is C6. The C5 and C6 is joining to form superior trunk. It is joining to form UT or superior trunk, which is clear here. Now C7 alone is forming the middle trunk and C8 and that of T1 together is joining to form the inferior trunk. So this is middle trunk or this is the lower trunk. So same. So if you will concentrate, you can just see this part only. So if you are understanding the trunk, so let's enlarge this diagram and contribute only to the part of the trunks only. Okay. After that, we will study about the other one. So here you can see here. Now see here. C6. Okay. C6. C5 joins to form the upper trunk, superior trunk. C7 alone will form the middle trunk. C8 and T1 will join to form the lower trunk. This is C5 and this is C6. That is clear. Now, let me use different color for the three trunks. So, yes, I will use this pink color for the superior trunk formation. I can use green color for the middle trunk. I will use yellow color for the inferior trunk. See here. So this is how the three trunks. This is yellow. This is green. This is just to make you understand, because first time when we study, we find this topic slightly difficult. So it is important that you should understand this. This is upper trunk, this is middle trunk, and this is lower trunk. Is it clear? Is it clear, everyone? Upper trunk, middle trunk, and lower trunk. Now let's focus on important branches from the upper trunk. So actually the good point is that only upper trunk is giving two important branches, and the branches are, only upper trunk is giving two important branches, and the branches are, it is giving one branch lower down and one branch superior. So it is giving suprascapular nerve, and it is giving the other branch, that is subclavian nerve, nerve to subclavius. So two branches are given. One is suprascapular nerve and other is subclavian nerve. Both of it will have the root value C5, C6, C5, C6. Okay. And again this superior trunk is dividing into anterior posterior division. So we will come to that point. Here what is clear from this image, that upper trunk is giving two branches. Upper trunk is giving two branches, that is the suprascapular nerve and the subclavian nerve. That is clear here. Okay. If you want, you can write it also. Upper trunk is only giving the branches, and upper trunk is giving two branches. Suprascapular nerve and that of nerve to subclavius. Nerve to subclavius. Now my dear aspirant, nerve to subclavius and suprascapular, both is having the root value C5 and C6. And when we are talking about suprascapular nerve, it is giving innervation to two muscles, that is supraspinatus muscle and that of infraspinatus muscle. When we are talking about the nerve to subclavius, by the name only it is clear, it is giving innervation to subclavius muscle. Subclavius muscle. Got it? Okay. Now, got it everyone? Okay, so we have done with the upper. Now let's talk about the chords of brachial plexus and its branches. At the end, I will give you a mnemonic for it also. Let me first show you all the branches from the chords of brachial plexus. So firstly, I would like to tell about the lateral cord. So when we are talking about the lateral cord, so see here. Here superior division, this is the anterior. So actually each of the, as I have already told, each of the trunk will divide into anterior and posterior division. So superior trunk anterior division joins with the anterior division of the middle trunk, and it will lead to the formation of lateral cord. Okay, that is clear, we have already talked. And the important branch of lateral cord is musculocutaneous nerve. Okay. And it is also giving lateral root to median nerve. See here, this is forming the lateral root of median nerve. So this is median nerve, lateral root is formed, and one more branch is given, that is not seen here, LPN. What is it? Lateral pectoral nerve. So LPN is lateral pectoral nerve. So this is the three branch. Lateral pectoral nerve, musculocutaneous, and lateral root of median nerve. These are the three branches from the lateral cord of brachial plexus. So again, I will highlight this with blue color. So this is the lateral cord which is giving following branches. It is giving musculocutaneous nerve, it is giving lateral pectoral nerve, and it is giving lateral root of median nerve. Actually median nerve is formed by both lateral root and medial root. Medial root is formed by median nerve. Done. Now let's focus on to the medial cord. Now this is the medial cord which is formed by the anterior division of inferior trunk, and it is contributing to form the medial root of median nerve. Okay, so here it is also contributing to form the median nerve, but it's medial root. Other than that, it gives following branches. It is giving ulnar nerve, it is giving medial cutaneous nerve of forearm and medial cutaneous nerve of arm. So yes, see here. So this is the ulnar nerve, this is medial cutaneous nerve of forearm, and this is medial cutaneous nerve of arm. And median nerve medial part or medial root is formed by the medial cord. Other than that, one of the nerve which is not shown here will be the medial pectoral nerve, will be the MPN. What is MPN? Medial pectoral nerve. MPN means medial pectoral nerve. Okay. Now, what remains is the posterior cord. So this is all done with the branches of the medial cord. Now we will move on with the branches of the posterior cord. Okay. So posterior cord is formed by posterior cord is formed by joining the posterior division of all the three trunks. So this is the formation of posterior cord, and it gives following important branches. It is giving one radial branch. Actually, this is the largest branch of brachial plexus. Radial nerve. It is giving axillary nerve. It is giving inferior subscapular, superior subscapular, and that of thoracodorsal nerve. See here. So the branches of the posterior cord. This is the posterior cord. Its important branches has been shown here, which is formed by the posterior division of all the three trunks. It is giving axillary nerve. It is giving important branch radial nerve, superior suprascapular, thoracodorsal, and inferior subscapular. So let me write the individual branches of the individual cord along with the mnemonic and along with the root value. Okay. So let's talk about that. Okay. So let's talk about the branches of, write on the heading, branches of lateral cord of brachial plexus. Lateral cord of brachial plexus. Okay. Yes, Varma. Good evening, dear Varma. Any doubt? Good evening, dear. So any doubt you can ask me. Okay. So let's talk about the branches of lateral cord. So we have already seen in the diagram. Now branches of lateral cord, you can memorize by the mnemonic, the medical leave 2. Medical leave 2. Medical leave 2. That is ML2. In short form, what you can write? ML2. Medical leave 2. So this is the mnemonic. If you have another mnemonic according to you, you can use it. So I memorize like medical leave 2. So here M and 2L. That means M and L and L. Okay, 2L and 1M. So here M stands for, musculocutaneous nerve. Musculocutaneous nerve. L stands for lateral pectoral nerve. Lateral pectoral nerve. Lateral pectoral nerve. Lateral, another L for lateral root of median nerve. Actually, all these median nerve, radial nerve, important nerves in detail we will talk. The nerves of upper limb, I will take another session in which I will discuss the nerves in much more detail. So here, the root value. So root value of musculocutaneous nerve is C5, C6 and C7. Root value of lateral pectoral nerve is again C5, C6 and C7. Root value of lateral root of median nerve is again C5, C6 and C7. So musculocutaneous nerve is giving innervation to the muscles of arm. Which arm muscle? Anterior muscles of arm. Anterior muscles of arm means coracobrachialis muscle and biceps brachii muscle and that of brachialis muscle. So I am just writing in short form because we will also discuss these in detail afterwards. So it is giving innervation to CB for coracobrachialis muscle, biceps brachii and brachialis muscle, musculocutaneous nerve. Lateral pectoral nerve is giving innervation to pectoralis major and that of pectoralis minor muscle. Lateral root of median nerve. Actually, median nerve is also formed by taking contribution from medial root, and median nerve is an important nerve which is giving innervation to muscles of forearm, anterior forearm. Most of the flexor muscles of the forearm is getting innervation from median nerve. So already we will talk about median nerve in much more detail. We will talk about median nerve in much more detail. I will take another session. So for now, you just know that median nerve is giving innervation to all the muscles, most of the muscles of the flexors of forearm. So done with this. Now let's move on with the branches of lateral cord done, posterior and medial cord. Now branches of lateral cord done. Now let's see the branches of medial cord. Branches of medial cord can be memorized by the mnemonic M for you. M for you. That means in short form, me for you. Me for you. M for you, me for you. So for 4. Okay. M for you, me for you. That means 4M is there and 1 U is there. So please write down the name of the branches here. M stands for medial root of median nerve. Another M stands for medial pectoral nerve. Another M stands for medial cutaneous nerve of arm. Medial cutaneous nerve of arm. Another M for medial cutaneous nerve of forearm. And U for ulnar nerve. U for ulnar nerve. So, next important point of view is to know the root value of each of the nerves. So, medial root of median nerve, C8 and T1, C8 and T1, C8 and T1, C8 and T1, and only ulnar nerve is formed by C8 and T1 and C7 in the bracket. So, it also take contribution from C7. What is C7? So, you can write it like this. C8 and T1, C7 in the bracket. C7 component is giving innervation to FCU, that is flexor carpi unlaris. C7, actually root value of the nerves are also important. So here C7, so here C7 component is giving innervation to FCU, that is flexor carpi unlaris. Flexor carpi unlaris. So got it? So mnemonic M for you, me for you, and this is the important branches. Okay. Now here, as I told you, medial root of median nerve, that will lead to the formation of median nerve, and median nerve is an important nerve which is giving innervation to medial root of median nerve. When joins with the lateral root of median nerve, will leads to the formation of median nerve. That means median nerve is having the root value C5, C6, C7, C8 and T1. And it is an important nerve giving innervation to all the flexors muscles of the forearm. Okay, medial pectoral nerve will again give innervation to pectoralis, major and that of minor muscle. Medial cutaneous nerve of arm will give cutaneous innervation to medial aspect of arm. Medial cutaneous nerve of forearm will give cutaneous innervation to medial aspect of forearm. Same as the name, it's easy, same as the name. The ulnar nerve, actually ulnar nerve is a very important nerve giving innervation to muscles, intrinsic. It is mainly giving innervation to intrinsic muscles of hand. It is giving mainly intrinsic innervation to intrinsic muscles of the hand. Intrinsic muscles of the hand. It is giving innervation to intrinsic muscles of the hand. Actually, ulnar nerve is just supplying only two muscles in the forearm. So it is an important thing which you have to know, but we will talk about the great nerves like ulnar nerve, median nerve and radial nerve in much more detail. But if we talk about here now itself, so for remembrance, just note down that median nerve is giving innervation to all the muscles of the forearm flexor group except flexor carpi ulnaris and medial part of flexor digitorum profundus, because these two muscles are getting innervation from ulnar nerve. Now, most of the muscles of the hand is getting innervation from ulnar nerve except the first and second lumbricals and that of thenar muscles. Okay, thenar muscles. So means most of the muscles of forearm is getting innervation from median nerve, and most of the muscles of the hand, intrinsic muscles of the hand, is getting innervation from ulnar nerve. So this is basically very important for you to know. Now, okay, let's talk about the next one, that is the branches of posterior cord. So let's talk about the branches of posterior cord. So actually, for understanding the branches of posterior cord, I have made a mnemonic, that is rats, and these rats are residing in upper self and that of lower self. Rats are residing in upper self and that of lower self. So here, so that means here R, A, T, upper S and that of lower S. Upper self and lower S. So this is how you are going to understand the mnemonic, and you have to know the name of each. Now, so let's start with this. So R here stands for radial nerve. Actually, radial nerve is the largest branch of brachial plexus, formed by contribution from C5, C6, C7, C8 and T1. So one of the important topic which has to be written here, that radial nerve is largest branch of brachial plexus, formed by the root value C5, C6, C7, C8 and that of T1. C7, C8 and T1. Actually, radial nerve is a very important nerve because it is giving innervation to all the extensor group of muscle. It is giving innervation to all extensor group of muscle. A stands for axillary nerve. T stands for, so basically let me write the name firstly, thoracodorsal nerve. Upper S stands for, and lower S. So upper S stands for upper subscapular nerve. And lower subscapular nerve. Okay. So here, when we are talking about axillary nerve, it is having the root value C5 and C6, and it is giving innervation to two important muscle, deltoid muscle and teres minor muscle. Actually, all these nerves, please don't get worried. We will have a different session where we will study the nerves in much more detail. I am just giving an introduction in the brachial plexus because this is the first session of brachial plexus. Thoracodorsal nerve. When we are talking about thoracodorsal nerve, it is also called as nerve to latissimus dorsi. What is the other name of thoracodorsal nerve? It is also called as nerve to latissimus dorsi. So by the name only it is clear that it is giving innervation to which muscle? It is giving innervation to latissimus dorsi. The root value is C6, C7 and C8. It is formed by ventral rami of C6, C7 and C8. Now, both upper subscapular, lower subscapular has got the root value C5 and C6. Upper and lower subscapular both is giving innervation to subscapularis muscle. Subscapularis muscle. Okay, subscapularis muscle. And the lower subscapularis is giving innervation to teres major muscle. Is giving innervation to teres major muscle. So these are most important branches, and we have already talked about the mnemonic rats in upper self and lower self. In upper self and lower self. Okay, any doubt please ask me. Any doubt please ask me. Anything which you haven't understood, please let me know. So in short, we have done with the formation of brachial plexus formed by the ventral rami of C5, C6, C7, C8 and T1. The trunks and the roots are lying in the neck. The cords are lying behind the division. The division is lying behind the clavicle, and the cords are lying in the axillary region. Okay. Now, the branches of each individual part of the roots, the upper trunk. So only upper trunk is giving two branches, that is nerve to subclavius and suprascapular nerve. The branches of roots are two mainly, long thoracic nerve and that of dorsal scapular nerve. Branches from medial cord is remembered by mnemonic me for you, M for you. 4M here stands for medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve, ulnar nerve and medial pectoral nerve. Branches of Shyans Biswas. Yes dear, we have, so actually I think you have joined late dear. I have shown you all the branches with the diagram already done here. If you will see, I have correlated all the branches with the diagram. Okay, all the branches with the diagram. Actually it is very important that you should go through this diagram where all the branches are correlated with the code. Okay, so all red color branches which you are seeing is the branch from the medial root. Blue color is the branches of lateral cord, and you can see brown color branches are from the posterior cord. So we have done with that, and it will be followed, Séance Biswas, it will be followed by one more session. So we will have 2-3 sessions on the brachial plexus. So don't worry, it will be repeated most of the time. Okay, most of the time. So actually I have to end the session and start an open house discussion. So there also, if you want once more, I will show you. So here if you want to correlate with the branches, see here. So I have to start. So see here, this is the lateral cord. So if you will see, let me just show you. This is the lateral cord, and here you can see the lateral cord branches. Here this branch which you are seeing is the musculocutaneous branch of lateral cord. Here is the lateral root of median nerve. So this is the median nerve, but this is the lateral root of median nerve. Here will be LPN, lateral pectoral nerve. Posterior cord, as you can see, formed by the posterior division of all the trunks. It is giving 3 branches here, and one is the axillary, and the largest branch is the radial nerve. Largest branch is the radial nerve, axillary nerve, and we have got other branches. As you can see here, we have got inferior subscapular, we have got inferior subscapular, we have got thoracodorsal and superior subscapular. These are all branches from the posterior cord. When I am talking about medial cord, one of the important branch is that it is also forming the medial part of median nerve. Okay, this median nerve is formed by both lateral and medial cord. It is giving one important branch. This is the ulnar nerve, and the other branches are medial cutaneous nerve of forearm and arm, and one more is medial pectoral nerve, MPN, medial pectoral nerve. Okay, Shyans Biswas. So don't worry, we will also have the repetition of this brachial plexus. So only I have kept 1, 2, 3 sessions of brachial plexus. So once more, if you want, I will explain the branches once more. Whenever this diagram will come, I will repeat it once more. So is it okay, Shyans? Have you understood? I have gone through each and individual branches firstly in this diagram, as you can see, and then I have written all the names. Okay. So before ending the session, let me just tell you about few important points. That All India mock test is going to happen on 19th Feb 9 am. Enroll in this test by using the code NAT10. This is absolutely free. So just take the advantage of being present in this test. NEET PG and Iconic subscription has been compared here. Have a look on this comparison detail and be the part of this session. You can use my code. This is how the nerves are formed. Okay, it's not so actually radial nerve, Seance Biswas, the radial nerve is formed by taking contribution from all the roots C5, C6, C7, C8 and 8. But when you are seeing the other branches of the posterior cord, it is just taking contribution from C5 and C6. It is how the nerves are branching and forming. It is not taking. So when we are talking about axillary nerve, when we are talking about upper and lower subscapular, they are not taking formation from all the ventral rami of C5, C6 and C8. They are sprouting out from only from C5 and C6 component. So this is how the nerve is formed. Only radial nerve is the entire. So only radial nerve is the largest branch of brachial plexus because it is taking contribution from the entire ventral rami C5, C6, C7, C8 and T1. Okay, Seance Biswas. Now, Iconic and Plus pricing detail. If you want to take the subscription, you can use this code and get an extra discount of 10%. So have a look on the pricing detail. Don't worry, you can join me also for the open house session. I will just start on the Unacademy app open house. Those who are watching the session and connecting to me first time, use the code NAT10. I will also elaborate few more points so you can just get connected to me. Okay, Seance Biswas, and don't worry, this session will continue. 2 more sessions will be there on the brachial plexus. So it will be, or at the end of 3rd session, you will entirely understand brachial plexus. So all the best, keep studying. Thank you so much. We will meet in the next session. Thank you. Do like, subscribe the channel. Okay. Do like, share and subscribe the channel of Unacademy Future Doctors. Future Doctor Unacademy. Okay. Attend free sessions by using the code NAT10. By using the code NAT10, enroll and attend free session and download the PDF notes. Absolutely free for you. Thank you.